Hi, my name is Dr. Vicki Roy, and I'm one of the owners of Dynamic Therapy Specialist. And I wanted to share a little bit of information about something that is near and dear to my heart and something that I talk with families about on a regular basis. And I'm planning to share some of this information with you all on our Facebook page over the course of the next several weeks. And so this is the topic of focus and attention. There are quite a few parents that contact our office whose child is having a difficult time focusing and attending. Either the teacher is complaining that they're having or talking to them about their child having a difficult time sitting in their chair for long periods of time. Their activity level is high, and or they're having a difficult time redirecting them back to their work. So when a parent comes to us because they're having concerns about focus and attention, there are quite a few things that I encourage parents to consider before jumping into a plan of action. And so specifically, oftentimes parents will come to us and they will have received a diagnosis of ADHD or ADD and a recommendation of medication. And although medication is oftentimes warranted and oftentimes helpful, there are also quite a few times when there are other things to be considered. And so what I want to share with you over the course of the next several weeks are things that you can be considering, some of the things that we look at directly in our office, and then some of the things that we just try to educate our parents on and provide them with resources in the community. So the first thing that I would encourage you to pay attention to and to consider is your child's sleep. And when I talk about sleep, yes, I am talking about the duration or the amount of time that they spend sleeping. So if your child is staying up till late hours of the night and getting up super early, I think most people recognize that that's not conducive to emotional regulation and efficient learning the next day, because as adults we experience that on a regular basis and we know that that's not helpful. However, the part of sleep that I talk to parents a lot about is not necessarily the amount of time. Yes, kids need to sleep and it needs to be a lot of sleep, but it's also the efficiency or the quality of that sleep. And so again, as our kids get into school age, that school age range, hopefully we're not sharing the bed with them as much as we might have been early on, and they're now independently sleeping in their own room. So you might not be as aware, but in order to get really good quality sleep, to get into what we refer to as stage 3 and 4 sleep, and those and that really deep, powerful sleep, that's where the body is going to detox and so filter out all of the stress hormones that have built up throughout the day. It's where you're going to take your short-term memories that you gathered up during the day and transition them into long-term memory. It is a really important phase of sleep at night. And so if you're not getting all the way into stage 3 and 4 sleep, then you are not doing some of the really important things that are meant to happen during the sleep process. And so how might you know if your child is not getting into good deep sleep? If you notice that your child is moving all over the bed, the covers are all over the place, that might be a sign that they are not getting into, they're having fitful sleep. And so they're not getting that rest, that rejuvenating sleep that they need in order to be successful learners at school, successful friends, and successful regulators of their own emotions. If they are snoring on a regular basis, then they also might not be getting into that really important phase of sleep. If they are grinding their teeth, there is a period of time when that is developmental and that it happens. But if that is something that is happening to the point where they are experiencing some wear on their teeth, that you notice it more often than not, then that might be a sign that they are not getting enough oxygen while they're sleeping at night, and so their brain is trying to keep them from getting into really deep sleep. Snoring, teeth grinding, night terrors, these are all potential considerations that might indicate that your child is potentially sleeping but not getting that really healthy, important sleep. Another thing, if they are waking up and they're still really tired. Now, I have young children. My 12-year-old is the king of waking up grumpy. He gets that from his mama. I'm not a morning person. And none of the things that I'm talking about are an absolute if-then, but they're things to consider. And so if you are seeing a combination of these things, so your child is getting 12 hours of sleep, but they're still waking up tired and grumpy and not refreshed and ready for the day, it might be something that you need to consider. If you go in and the sheets are all over the place and no one wants to sleep with them because they're just moving all over the place, it might be something to consider. If your child is waking up or is having night terrors at night, that's different from nightmares, but night terrors is, essentially still asleep, almost like hallucinating in their sleep, where they're talking and seeing things, but yet are actually still asleep, grinding their teeth. Mouth breathing. If you go in and the mouth is always open, my youngest, this is something that we've been working on, and because it's most important that you breathe through your mouth, and that's how we breathe most efficiently. That's the healthiest way to breathe. And so at night, if you are mouth breathing, it might indicate that the tongue is not in the best place and is falling back and blocking off your airway, and so therefore you are unable to breathe through your nose, and so the mouth automatically is opening in order to get that sufficient oxygen throughout the night. And so these are just a couple of things that I would encourage you to consider and to start noticing. If your child is really struggling with focus and attention, from my perspective, that is a matter of the system is not doing the things that it needs to be doing automatically in order to support higher learning, higher order learning, social development, emotional regulation, and then really high level thinking requires the system to be as efficient as possible. And so it is something that if you are seeing this plus some other things, that might indicate a need for you to look beyond medications, because there might be something that could be that someone could intervene and create some ease in the system that would decrease and maybe even eliminate some of the focus and attention problems that you're seeing. So one of the first places that we want to take a look at and consider is sleep at night. What does your child's sleep look like? What is the quality of that sleep? Oh, one other thing that I forgot to mention, if your child is waking frequently throughout the night to use the restroom, that might be an indicator that they are not getting into good quality sleep, into that stage 3-4 sleep, because when we get into that phase of sleep, your system actually slows down the production of urine, so that you can go longer chunks of time without needing to go to the restroom. And so your child, if they're experiencing bedwetting beyond the age at which potty training is expected, so you have a 4, 5, 7-year-old child who is having bedwetting issues, that is definitely something to consider, or just waking up and needing to go to the bathroom. So in summary, these are things to consider. They are not a one equals or A equals B, but they are things that if you are saying to yourself, wow, we have several of these things going on, and this is something that we probably want to have a conversation about, then this is definitely an area that we can talk to you more about at our office, and point you in the right direction, as well as help you to consider some other areas. Those areas we'll be talking about over the next couple of weeks for you to consider as a possible contributing factor to your child's difficulty with focus and attention. I hope that that was helpful for you. Would really love to hear if there are other areas that you are interested in hearing more about. I'm going to talk about focus and attention for a couple of weeks, and then shift that into some other areas of concern that we talk with families about on a regular basis. And so if you have some ideas, feel free to share that down in the comments or reach out to me directly or our office. You can send an email to info@dtsbr.com. You can put a comment down below and give us your ideas and thoughts. And you can tune back in next week and see what's the next area that you might be wanting to consider if your child is struggling with focus and attention.